Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, Tracy, this past May, as you well know, Mayo Clinic continued its move to a single integrated electronic health record and billing system with the implementation of Epic at its Rochester, Minnesota campus. Now, the project is called the Plummer Project, building on the legacy of Dr. Henry Plummer. Dr. Plummer created the world's first patient-centered health record at Mayo Clinic more than a century ago.
The Rochester Go Live was Mayo Clinic's third of 4 implementations. Epic first launched across Mayo Clinic Health System in Wisconsin and in Minnesota in 2017, and Mayo Clinic's Arizona and Florida campuses are scheduled to go live with Epic this fall. In total, more than 51,000 Mayo Clinic employees will be trained to use Epic, including you, Dr. Tom Shives.
And it has not been easy.
Here to discuss lessons learned through this process is Dr. Steve Peters. Dr. Peters is a pulmonologist at Mayo Clinic and is co-chair of the Plummer Project. Welcome to the program, Dr. Peters. It's nice to see you.
Thanks for having me.
Dr. Peters. Whew. Huh? So it was 3 weeks ago that we implemented Epic at Mayo Clinic Rochester. Was it more difficult or easier than you thought it was going to be?
That's a great question. It's hard to answer. I think on balance, it ended up pretty successful, such that it's probably a little easier than I thought it would be, or that I feared it would be. It's been actually about 4.5 weeks since May 5.
Well, it went so fast.
One rewarding part is to see the colleagues who might have been struggling the first week or two, who now have really settled in to kind of a day-to-day mode. There are still a lot of little pockets of difficulty with workflow or learning the system, but overall, as an entire enterprise, it's felt to be very successful.
Aside from hoping that Dr. Shives' head would not explode, what was the main reason? Why the need to change what we at Mayo Clinic were doing, or what other medical institutions are doing that is causing people to change to this?
Right. There are several drivers for this. One was as Mayo Clinic grew over the past 30 years and more, and we spread out geographically, the sites developed somewhat their own identity, but also their own sets of tools, orders, solutions, ways to evaluate clinical problems. And our leadership felt that we were losing some of our common experience or patient care or best practices, and we wanted ways to disseminate our knowledge everywhere to each patient at each location. Mayo had been operating more or less as a holding company of some of the sites, but as they became more integrated, we were looking for practice integration as well, and we needed tools to do that. A very specific reason is that the core medical record in Rochester, which is based on a General Electric product, is going out of production, and the support for that will end at the end of this year. So we had a very concrete reason why we had to change in Rochester, and a strong desire to converge on a common set of tools at every site. So we have one version, one instance of Epic across 3 time zones when we're completed with the project this fall.
This program is on almost now 200 stations across the country. Is this something that a lot of hospitals are going through because of that General Electric product going away?
It's a relatively small number of enterprise customers on the GE Centricity product, and they all will make a change. They'll be required to. On a broader sense, almost every hospital in the country has gone to electronic medical records. So the experience is very common. The size and complexity of our implementation is not common. We're not positive, what we think, along with Epic, that we were the biggest single implementation at one time that had been done.
Huge undertaking, but at least now we're all on the same page from a medical standpoint and a healthcare record standpoint. But I did read that when this is over, you will have trained 51,000 Mayo Clinic employees at the 3 sites plus the health system. How do you go about doing that?
Right, that's correct. I think we probably have about 65,000 employees total, but 10 to 15,000 of them don't use the medical record on a regular basis and so haven't needed to be trained. We're probably at about 42,000 that have been trained so far, and another 9 to 10,000 to go in Arizona and Florida. The training is a project unto itself. It has a very specific plan, a curriculum. It requires some self-study by each learner, and then hopefully focused and brief classroom training, and then ongoing on-the-job learning after we're live.
Because it does take a fair amount of training. I would say, as a physician who's trying to learn this, that it really isn't an intuitive system. Is it more intuitive for a younger individual than it is for somebody who's been here for a number of decades?
It's interesting to watch. You would think so, and in some cases that's true. I have watched a younger physician left-clicking, right-clicking, double-clicking without fear of doing anything wrong, as others, perhaps more experienced, might have done. But at the same time, we've had very senior physicians, nurses, and others who have adopted it very quickly. So it's not directly related to age.
So you've done the health system. You're in the process of completing the project at Mayo Clinic Rochester. And what's next, Arizona and Florida?
Correct. Arizona and Florida go up together at the same moment on October 6th.
So you've still got some work ahead of you.
Correct. We'll be turning our attention, we're leaving some support behind at each of the sites that has gone up, and then turning our attention to the planning for Arizona and Florida starting now.
Why was it that you said yes when they asked you to be a co-director of this project?
Well,
What were
the
you
project, it's a challenge, but I have been involved for at least 25 years with other medical record applications in Rochester and many aspects of it. And so I felt that perhaps I could help, and I was interested and excited to do it.
Well, yeah, you're fabulous, extremely bright, and we're so glad that you were willing to do this as co-director. So what lessons have you learned? What might you do a little bit differently when you get to Florida and get to Arizona?
We've learned a lot from the earlier implementations. We've modified the training and made it more focused to the tasks or some of the scenarios that an individual needs. We've increased the number and the training of the super users. Those are individuals embedded in the practice, whether it's physician, nurse, desk staff, who really help to understand their local workflow rather than just how you navigate the tool. And then fine-tuned where more support would be needed and which types of workflows. For example, moving from one setting to another, from an outpatient to inpatient, or emergency room to an interventional radiology procedure to the operating room. These are pose kind of special challenges where we can focus some of the training and some of the build of Epic so that it is more easily done.
Will you get a trophy or anything when you get this all done?
A week off,
maybe? You have worked today and tirelessly for months to get this done.
Well, I don't know if there's a trophy in it, but I enjoy doing it, and I have plenty of time off coming.
You get a ribbon for participation. I know you will.
That's good.
All right, we've been talking about Mayo Clinic's implementation of the new electronic health record called Epic with Dr. Steve Peters, who is co-director of the project. Dr. Peters, thanks for all you're doing, and we appreciate it, and thanks for taking the time to be with us.
Thanks for having me.